So thank you, Sue, and thank you for the invite to talk this evening. So I'm going to be looking at the presence of Eurocentric research and alternative views and supporting the use of non-Western research methods. This is something that I started to explore a methodology which would be appropriate for the sample woman that I wanted to research. And in that case, it was migrant African women. And I kind of fell down this rabbit hole of looking at other methods which were not from the Western or were not from Western perspectives. So before I start, I just want to just emphasize that, yes, the methods are important, but also just to remind people that the space where the research takes place is also important, and also reshaping and transforming researchers' identity is also of relevance. But I'm going to focus on the methods and the importance of those methods. So first of all, we need to look at our historical past and look at the impact of colonization. So we know that in our history, there were invasion of lands by powerful groups, and culture and political systems were enforced on indigenous people. And this happened across Africa, Asia, the Middle East, America, Australia, Canada, New Zealand. And these are just some of the places that were colonized. And if you think about colonization, the impact of that was the impact of enforcing knowledge that was embedded in Eurocentric theories. So in the present time, in the present context of today's world, a lot of the Western universities have Eurocentric theories in their establishments. And therefore, non-Western and indigenous knowledge is mainly disregarded. And so therefore, the premise is that research is constrained by Westernized methodologies. Now, what does that mean? It means for those indigenous populations, this is a word that probably is a little bit shocking, but it's a dirty word. They had was suppressed, it was diminished, it was demeaned, being relevant. And knowledge is important because knowledge is used as a way to overpower those who have less knowledge. And in the current world's view of knowledge to others, however, there are alternative ways of viewing the world, but these are not considered. And therefore, because of that, some knowledge does remain invisible. And if you think about the importance of knowledge and the importance of non-Western approaches, if we are using Western approaches for researching non-Western populations, is that true knowledge that we are actually retrieving? And is there, in fact, a loss of real knowledge? And if you think about the UK, the context today of our childbearing population, it is very diverse. We have a very migrant population, particularly in the UK, and also a lot of Western countries. And so therefore, if we are researching individuals in this way, are we catering for all those individuals? And so therefore, is there justice in research? Because if you're not hearing the views of everyone, and only a small pocket of women are being presented in research studies, it means the voices of those who are not researched are not heard in policy, they're not heard in practice, and they're not heard in guidance. So how about if it happen at all? However, we can't do that. And basically, that's not correct to do that because the past is our past. That's our history. We have to probably just accept it as it was. But can we correct the past and the impact of colonization? I think that's something that we probably need to start doing. So decolonizing research is an approach that challenges Eurocentric research methods. And within that, there is acknowledged different sources of knowledge, and the research is culturally sensitive. And that is the pathway that we need to start looking towards. Been around for a few decades now, this perspective of Eurocentric research. However, even though it's been around for a few decades, it's not actually present in our current context of midwifery research, or it's not evident. Experienced education and learning. We go to school, we go into higher education, and we are taught that this is the correct way to acquire knowledge. And knowledge which is based on the idea that having a true belief is not sufficient to be valid in the Western context. And basically, when we look at the Eurocentric perspective, we believe that knowledge should be gained through systematic study data. And if we look at knowledge that is not achieved in this way, it's deemed to be insufficient. And therefore, this positions European perspectives as the norm and non-Western perspectives as deviations from the norm. So, what do we need to do about the current midwifery research practices? Do we need to adhere to what is acceptable? This is what we are taught. We are taught about research design and approaches, but these are mainly framed on Western perspectives. And this impacts on diverse views and other ways of knowing. But we know, and I think probably there's a lot of academics who talk about this, we know that there are other ways of gaining data. However, if you want to do a BSc, an MSc, you want to do doctorate studies, PhD studies, you want to get funding for a study, you have to adhere to these practices and these approaches because that's what they're looking for. This is deemed to be science, is deemed to be the correct way of doing research. So that's a problem there. So even if you're coming from the non-West to a Western part of the world to undertake a study in a university, and you may know that there are other ways of achieving knowledge in your own population, you have to adhere to this because this is what universities expect you to do. You probably could try and do it another way, but it might be quite difficult. And it just might prolong your studies, which you don't want to do. And if we look at the context of indigenous knowledge or non-Western knowledge, this is knowledge that is passed down, traditional knowledge passed down orally from generation to generation. It's normally culturally specific knowledge. It's unique to certain populations, but also could be useful to other populations. And so therefore, when you think about our migrant population in the UK and other parts of the Western world, this could be relevant in ensuring that they are researched appropriately and sensitively as well. And if we do continue to use Eurocentric research methods, this can lead to exclusion of other ways of knowing and being, and also may not be adequate for diverse individuals. And assumptions also can be made which are not always correct. And of course, we have the power imbalances as well, which occurs with that. So we need to have midwifery research that recognizes the past and the present, and that's what we need to aim for. So let's think about these non-Western perspectives. And let's focus on these methods that we can use. So they do originate outside of dominant Western tradition, academic tradition. No particular approach is deemed to be the most valid, can be any approach. We need to think about alternative methods to collect knowledge. And I just picked out a few. storytelling, dance, singing, and drawings. And so, for example, there's many oral cultures around the world, and in a lot of non-Western and indigenous populations, narrations, which are sacred stories, are used to hand down knowledge, if you like. So this unites past and present experience. And therefore, individuals' perceptions of birth could be researched by listening to those sacred stories. That's a wealth of knowledge that we really haven't explored fully. And if you look at Australian and American indigenous populations, there's something called yarning and talking circles which are used. And this is sharing of indigenous knowledge. And why can that be why can't it be a method that we use to research non-Western populations or people of different cultures? And then if you look at dance, song and dance has been used as a form of non-verbal communication. And it can be particularly useful for looking at people's views. And it can reveal cultural and traditional practices. And in African societies, pregnancy and childbirth are usually used rituals and birth songs to describe their experiences, and that can be useful. And then in some Asian cultures, we have dance news, and that can display deep cultural meanings and concepts around social structures as well. And then if we go on to look at drawings, now we know in the West, we can use visual ethnography and pictorial data collection methods to explore people's views of a certain experience. But also drawings and art is good because it enables the researcher to see the world through participants' eyes. And this is particularly useful for individuals who don't have a good command of English, they're not native English speakers, or there might be some other kind of language barrier. And this will be good for those who participate in research by using drawing as a data collection method. So what do we need to do? We need to make sure that in order to make sure that our research processes are more inclusive, we need to adopt research methods which are culturally sensitive, because it might be that the Western research methods, and I'm talking about we typically do interviews, focus groups, observations, surveys, questionnaires, but may not always be culturally sensitive. And we need to think about valuing all knowledge. We need to value diversity and increase inclusivity. We need to cater for all cultures. We need to move away from this Western dominance in research. And if you think about embedding the presence of all knowledge, educational facilities need to start thinking about teaching different methods of collecting data and not the traditional Western methods. It really shouldn't matter what the methodology is. Gaining the knowledge is the most important thing that we should be trying to achieve. We need to step out of our comfort zone, because I think we are in this comfort zone of using these Western methodologies. And knowledge should be knowledge in any context, not just a scientific one. And so ideally, how about merging Western and non-Western perspectives, tailoring research to the individuals that are being researched, and collaboration of different approaches to meet the needs. And now, what does it look like? It looks like maybe if you're doing a research study or project, there could be a myriad of methods that you're using, depending on who the person is you're having contact with. And that might be good. And that would go some way in reducing inequity in research participation, because we know there's an issue with people from certain backgrounds not participating in research. So then I thank you. That's the end of the presentation.